categorized in that way. And they're all numbered so that Sean is going to send out a sign-up sheet where you can all talk to each other and you can say, I want to work on app 1 or app 2 or app 5 or whatever if you want to work on one of them. So I'm going to just we're going to fly because there's like 35 of these. And so I'm going to say one sentence about each one. And someone has to yell or tackle me if you want me to say more about it. And I know this much more than the one sentence summary here off the top of my head, but we have like documentation from each person, like sometimes pages of documentation about what they want built, so you can keep that in your mind. So this is one where they want to collect information from users on adolescent risk behaviors and then maybe present some risk information back to those people. So this is a group running a study on adolescent risk. This is a Baltimore group that wants to build a directory of small grassroots nonprofits. And then be able to share information across those nonprofits. And so they have some ideas about which nonprofits they would like to be indexed in their app. This is one to gather history data from parents of children who participated in clinical trials, and in particular in vaccine studies. So it's a group running vaccine studies, and they want to collect information over time from the parents of those kids that are involved in those studies. So you can see up here I've got labeled like this one is going to involve like tidying up some data and things like that. So here is one where they would like to collect sleep information from a patient population. So it's like a population of patients that they're actually working with. They'd like to collect sleep information for a disease that I do not know anything about, and then correlate that sleep data with their level of pain. And so many of these apps, like this one, this is an extremely specific use case, right? Like this one disease. But you might imagine this is the kind of thing that lots of people for lots of different diseases might be interested in. So as you're looking at these, you can build an app that's for one particular use case, but have in mind you might imagine expanding your usability out beyond that. So this is one where we have patients that suffer from pain, and so again, this is another sleep habit one, so they want to collect sleep habit data. So like as you can see, these are two separate groups that both want to study sleep habits, so it's a generalizable problem. So this is another one that collects sleep data, but they also want to collect some pain data. So this is like 3 separate Hopkins groups that all want to solve this problem. So you might imagine that was one that if somebody solves, they would have a lot of users. So this is one where they want to build an app to help patients predict for themselves if they're going to get post-endoscopic infections. And so they have data on what are the likely risk factors for endoscopic infections and things like that. So you would involve building some kind of statistical model and then putting a front end on it so patients could interact with it. And so the data is available, and they probably have some baseline statistical model that you can start to work from. This is one it's much more molecular biology focused, but it's a tool to sort of deal with single cell sequencing data. So this is data where they do genetic sequencing of individual cells in your body. This is some real sci-fi technology, and this is like one of the world's experts is here at Hopkins, and he wants people to be able to interact with that data. So this is one where they have longitudinal, this is like particularly relevant if you're thinking about the opioid crisis. This is a person that has longitudinal pharmacy claims for millions of Americans. So this is millions of people, what they went and got from the pharmacy every single time, and they want to be able to study the opioid epidemic and when are people going and getting too much opioids and things like that. So that's another app. This is one for risk communication prior to surgery. So there's a surgical risk calculator app, which if you go and check out this website, it's very nice, but it's very, very kludgy. And so they want to build a nicer app with more functionality for risk prediction after surgery. This one is near and dear to my heart as a Coursera data analysis instructor. So we want to build a dashboard for instructors, teaching staff, and instructional designers so that people can look at performance and demographics in these Coursera courses where millions of people are taking. Here's one where we want to take Baltimore-based community organization information and put them on a GIS map. And so they have this website here that you can go to, and you can get information about what they actually want to overlay. So this would be an interactive map that people might want to build for this app. This is Soccer Without Borders. Would like to do an app that tracks participant progress in Soccer Without Borders and gives people badges. So this is a organization that basically is good for introduccing children to sports in places where they might not have access. This is one that's already been started in a previous version of this class, but they want to take it all the way to making it like really usable by end users, and so it's home assessment. So it's for older people, older patients, and older individuals going into their homes and evaluating what are the risk factors in those homes and building an app for that. This one is building a summary for after a home visit to promote self-reflection on like how that went for people, and it's particularly for American Indian young mothers to promote healthy childhood development. So you can see that we have a bunch more of these, and I'm going to blast through them here, but like you can already see some themes developing. The main kinds of apps that people want built are something either where they're collecting some kind of data from the end users, where they're visualizing that data for the user and they can interact with it, or they're maybe showing a model and how that model is working. Are there any questions? Like I know I just blasted through 15 of these. I'm about to do like 30 more of them. So like rather than be totally mind-numbing, does anybody have any questions about? No? All right, I'm built for speed. Let's do this. So the app, this is people who have an autosomal polycystic kidney disease. So this is one where they would like to do store data about the patients and treatment history and share it back with them. We have an early idea about how to store data that needs to be HIPAA compliant. That we've looked up some of the research on how to do that, and so that would be involved, some of this, building this app would be involved with trying to figure out how to do that. There's another one for community events for seniors or elderly, so like basically being able to distribute information for elderly patient population, or elderly people, where are their community events and all that kind of stuff in one synthesized way. This is a local Baltimore organization that wants to do this. Another one is, this one is like one I really hope gets built, which is to develop a data collection app for trans women to use securely user-informed resource center. So this is a group that does health work with trans women, but they found that the main thing that, like before they can even get to health, they have to like provide resources for them about like just how to like deal with day-to-day life stuff. And so they want to build an app for like making that information available. Of course, this one would also involve like thinking about information security, and so that's another thing that we're going to think about in the class. This is an app to promote emotional well-being for young people with interactive activities. They already have like a head start on a website there. So this is one for caregivers around the world so that they can report incidents. So like a centralized resource where people could report incidents and troubles with elder care or with child care. This is one for collecting information about college readiness, and so it's in particular trying to identify ways there are certain demographics and certain subgroups of students that traditionally have done poorly when moving from high school to college, and they want to track information about that and try to study that problem and try to improve it. This is one where they can, another kind of technical, complicated molecular biology one, but this is one where there's an antibody response that they want to study, and they want to be able to visualize information about the antibody response and share it with people, like a broader audience of people. And of course, there's a lot of words that you or I may not understand there, and part of the process is like trying to make it very understandable. So this is another one, this is an interesting one. They want to find people who had polio using social media and a new app, and then collect those people and try to enroll them in a study. This is an extremely hot topic right now with the President's Personalized Medicine Initiative. One of the main ways that they're trying, like, and by the President, I mean like former President. The President's Personalized Medicine Initiative is basically designed to, like, one of the ways they're collecting patients for these really rare diseases is through social media. So this would be an app to do that. This is one for people who have substance abuse disorders, and they want to be able to like track them and give them information and ping them and to try to keep them on track. This is one for streamlining data collection for community facilitators, in particular in healthy cooking programs in neighborhoods. This one is to prompt patients again to assess common post-procedural complaints and like store all that information and make it accessible for people. This one, I love the title, SoulRelate, but it's for vulnerability platforms. So basically the idea is they want to facilitate ways for people, in this case particularly young women and later young men, to interact with each other in a way that's positive if they don't have a lot of positive interactors in their lives. So they want to do that through the internet. Another one, so this is, as you can see, Northeast Baltimore. They want to be able to collect information and track involvement about the households that are involved in that local community project. So we have everything from like global, like world effort type stuff to like can you help the local Baltimore, community track their information? And so we're hoping that by collecting this variety of projects that everybody will find something that they are excited about and are interested in doing. So this is an app for interactive visualization of Baltimore city food deserts. And so right now there's some very specific parameters that have been set, and it'd be nice if you could tweak around with those and explore the data more carefully. This is for identifying funding, community and funding opportunities around early childhood education. This is one for basically being able to collect information from their staff and then predict out what are they going to do, what's the next quarter's business issues that are coming up, but identifying that in a large organization, how do you bubble that up from the low-level staff? This one is to identify whether if you do something on social media, it actually turns into a government output. So this is another Baltimore City project. And the idea is imagine you tweet, there's a pothole on Washington Street. Does that pothole actually get filled, and how long into the future it takes until it gets filled? They want to be able to measure both the social media part of it and what actually happens, and is there an interaction between those two things? This is a local company, WellDoc. And they're interested in doing real-time reporting from information about their company, about users, and healthcare information. So this is another one where if you're interested in doing something more entrepreneurial, we have a couple that have come in from both local and more established companies. This is one of those. So this is another one about hospital staff to provide real-time feedback on patient experience, so responsiveness, all that kind of stuff. And so the user would be able to be prompted and would be able to provide information about how hospital staff is working. So for each of these projects, there's a person behind it. In other words, there's every one of these has been submitted by either a person or an organization. And so as part of that submission process,